Erectile dysfunction. When should you actually worry? You can get an erection sometimes, but when you actually want one, it doesn't work. Or maybe you can get an erection but you lose it during sex. Does that mean you have erectile dysfunction? Not necessarily. Almost every man will experience erection problems occasionally. Stress, alcohol, lack of sleep, anxiety, or simply having a bad day can all affect erections. But if it keeps happening, that's different. And here's something many men don't realize. Persistent erectile dysfunction isn't always just a problem in the bedroom. Sometimes it can be an early warning sign that something else is happening in your body, particularly with your blood vessels. I'm a practicing urologist, and in this video I'll explain when erection problems are still normal, what commonly causes erectile dysfunction, and when I think a man should actually get it checked. What actually counts as erectile dysfunction? Erectile dysfunction, or ED, means repeatedly having difficulty getting or maintaining an erection that's firm enough for satisfactory sexual activity. The important word here is repeatedly. One unsuccessful night does not mean you have erectile dysfunction. Neither does occasionally losing an erection. Erections are surprisingly sensitive. They depend on your brain, nerves, hormones, and blood vessels all working together. And psychological factors matter too. So occasional problems are extremely common. What interests me much more is when a patient tells me, "This used to happen occasionally. Now it happens almost every time." That's when I start looking for a reason. One question I frequently ask patients is, "Do you still get erections in the morning? Why?" Because spontaneous morning or nighttime erections can give us information about whether the physical erection mechanism is still functioning. Imagine a younger man who has good morning erections and can get a normal erection during masturbation, but repeatedly loses his erection with a partner. That doesn't prove the problem is psychological. But performance anxiety, stress, or other psychological factors move much higher on my list. On the other hand, if erections have gradually become weaker in every situation, including morning erections, I'm more interested in possible physical causes. It's a simple question, but clinically it can be very useful. What causes erectile dysfunction? One of the most important physical factors is blood flow. To produce an erection, blood needs to flow into the penis and remain there. That's why conditions that damage blood vessels can also affect erections. Diabetes, high blood pressure, high cholesterol, smoking, obesity, and cardiovascular disease can all contribute. Certain medications can also cause or worsen erection problems. And in some men, hormonal problems such as low testosterone may play a role, particularly when ED occurs together with reduced sexual desire or other symptoms. But testosterone is not the explanation for every erection problem. This is one of the most important things I tell patients. The blood vessels supplying the penis are relatively small, so vascular disease can sometimes become noticeable there before it causes symptoms elsewhere. That means persistent erectile dysfunction can occasionally appear before more obvious cardiovascular problems. I'm not saying that every man with ED has heart disease. Absolutely not. But if a man develops persistent erectile dysfunction without an obvious explanation, especially if he also has risk factors like smoking, diabetes, high blood pressure, or high cholesterol, I don't think we should only treat the erection. We should think about the man behind the erection as well. What about stress and performance anxiety? Psychological factors can have an enormous effect, and sometimes a vicious cycle develops. A man loses his erection once. The next time he has sex, he's thinking, "What if it happens again?" Now, instead of being sexually aroused, he's monitoring his erection every few seconds. Is it hard enough? Am I losing it? Will my partner notice? That anxiety itself can interfere with the erection. Then it happens again. And the anxiety becomes even stronger the next time. This can happen even in completely healthy young men. Another thing I pay attention to is how the problem started. If a young, otherwise healthy man suddenly develops erection problems during a stressful period but still has normal spontaneous erections, that's one pattern. If someone tells me, over the last 2 years my erections have gradually become weaker and weaker, that's another. A gradual deterioration makes me think more carefully about physical factors such as vascular health, medications, metabolic disease, or hormonal issues. Again, no single clue gives us the diagnosis. But the pattern matters. When should you see a doctor? If erection problems happen once in a while, you usually don't need to panic. But if they're happening repeatedly over several weeks or months, especially if this represents a clear change for you, it's reasonable to get evaluated. A doctor may ask about your symptoms, medications, sexual function, and general health. Depending on the situation, blood pressure and blood tests may also be useful. And please don't be embarrassed to talk about it. For a urologist, erectile dysfunction is an extremely common medical problem. You're definitely not the first person to walk into the room with this question. Can erectile dysfunction be treated? Yes. And treatment depends on the cause. Lifestyle changes can be surprisingly important, especially when cardiovascular risk factors are involved. Exercise, weight management, stopping smoking, and improving diabetes or blood pressure control can benefit both general health and erectile function. If anxiety or psychological factors are important, addressing those can make a major difference as well. And then, of course, there are medications such as sildenafil, better known as Viagra, and tadalafil. These medications can work very well for many men. But they don't create sexual desire, they don't automatically produce an erection without sexual stimulation, and they're not appropriate for everyone. In particular, they can interact dangerously with certain medications such as nitrates. So when should you worry about erectile dysfunction? Not after one bad night. Not because you occasionally lose an erection. But if the problem becomes persistent, progressively worse, or clearly different from what is normal for you, don't simply ignore it. Especially because erectile dysfunction can sometimes tell us something about your overall vascular and metabolic health. Pay attention to the pattern. Do you still have morning erections? Does the problem occur in every situation? Did it start suddenly or gradually? And do you have cardiovascular risk factors? Those questions can tell us much more than simply asking, "Can I get an erection? Yes or no?" And if you're wondering whether Viagra could help, and what it actually does inside your body, watch my Viagra video next. I'll explain how it works, the side effects you should know about, and who needs to be careful when taking it. Thanks for watching, and I'll see you in the next video.